The students have kindly dubbed her Natalie. She was a brand new addition to us this semester, and she allows the students to have the experience of maybe a labor and delivery patient here in a safe environment before they go and see and do and touch real people.
Natalie is a human but in a plastic body. She does everything that we can do except walk. She can talk. She's a human, pretty much, and thanks to Shannon, Shannon gives her that life.
When she gives birth, there's a lot that is truly simulated. The real, fluids that mimic birth fluid, those kinds of things. Same with, any kind of blood or anything. It can all look very realistic, and actually to see her give birth and how the baby's head turns upon delivery, that all happens with her. So it's pretty amazing.
For the very first time, we had a class with Natalie, with Dr. Jones. My first thought was, wow, that's amazing. Because I didn't know that a man can have blood, can have a baby going through her vaginal canal, and that was a big surprise. That was a really big surprise.
A lot of schools are actually having to utilize their simulations with their mannequins as their clinical experience because they can't get their students in to see real live people and real live births. So we're fortunate to be able to do both. So we get to use SimMom as our practice and then to take care of the baby here as well. And then they can go out and use those skills that they've practiced.
It's interesting, Shannon's actually out of the room usually because she has a microphone. So it's like speaking to a real patient, but it is a little strange at first. You have to kind of get used to the fact that, yes, you can hear her talking, but you can't see her mouth moving. It's just a little bit different, but it's a good experience.
The calling on, I think, this program and the students that are going to graduate from here is huge. And so I take that seriously, and but I'm also honored and excited to be a part of that.
So we are like a Christian family, and we share our burdens. We have seen how God has moved powerfully among us, and we are so thankful.
Natalie is very important to us because she gives us real world experience without having to be in the real world. We can make our mistakes on her and learn from them instead of enduring someone in the real world.
We're able to teach that holistic care. We've already had students praying with patients in the hospital and holding hands when something's going wrong, and giving that love that I think is so comfortable with our nursing students here at Lee. We're kind of creating that whole package and putting out great nursing students.